Welcome to our dental caries video. If you have ever noticed a cavity in your tooth, you may be wondering how to fill it. Your dentist will numb your mouth with a local anesthetic and use a drill to remove the decay and shape the tooth so that the filling will be smooth and secure. More advanced cases of dental caries may require a root canal or tooth extraction. To find out if your teeth are at risk for dental caries, it's important to know what to expect. Pathophysiology. The pathophysiology of caries has been studied by many researchers for over a century. Though no specific bacterium has been proven to be the cause of caries, it is likely that the overgrowth of acid-producing oral flora and excessive sugar consumption play a role. In addition to this, several other bacteria are implicated, including Streptococcus mutans. Therefore, an understanding of the entire pathophysiology of caries is vital for preventing and curing the disease. Bacteria living in the mouth are called cariogenic bacteria and can break down complex carbohydrates into sugars in the mouth. These bacteria attach to the surface of the teeth and form colonies known as plaque. This sticky mixture of bacteria and food is the primary cause of caries. Bacteria in the mouth live in the plaque, which is the main component of the oral cavity. Cariogenic bacteria are most active in anaerobic conditions, such as the mouth. The fermentation of sugars produces acid, which the bacteria feed on. The pH of plaque fluid decreases, allowing these bacteria to attack enamel rods, cementum, and expose dentin. In severe cases of poor oral hygiene, dental caries can develop within months after the eruption of the first tooth. This is often accompanied by a diet rich in fermentable carbohydrates. Furthermore, baby bottle sugary drinks are a primary cause of caries. A combination of these factors may be responsible for the development of this disease. However, in most cases, the cause of caries is not found in the mouth. A combination of genetic and environmental factors, which are present in the mouth, contributing to this disease. Early detection. The early detection of dental caries is essential for effective therapeutic and preventive approaches. However, most existing clinical detection methods are not sensitive enough to detect early caries lesions. To overcome this problem, several optical modalities have been proposed. Most of these methods are based on the enhancement of light scattering or absorption at the site of early caries. Nonetheless, there is a need for more sensitive methods. Currently, most clinical caries detection methods rely on visual observation and are largely insufficient to detect dental caries in their early stages. To develop the most effective sensitivity and specificity, a dentist should study the optical properties of the teeth. This is because tooth structure is multifactorial and some factors can affect the sensitivity of a detection system. For example, longer wavelengths penetrate the deeper tooth structure, which can result in missing small areas of decay. Another factor to consider is the location of the study site and whether or not the tooth has any restorations. In addition to visual diagnosis, other methods such as bite-wing radiography should be used in diagnosis. Although visual diagnosis is still the most common means of detecting caries, there are also newer, more accurate methods. In fact, one of the most reliable and reproducible methods has been developed by an international group of researchers. TPLI and OCT are two types of optical imaging techniques used for dental caries detection. Both methods have their advantages and disadvantages. The former offers better sensitivity and threshold, while the latter exhibits better sensitivity and specificity. Interventions. The U.S. Preventive Services Task Force has published recommendations for screening children for dental caries, or tooth decay. Dental caries occurs when the outer layer of a child's tooth is damaged. Tooth decay is caused by a combination of genetic factors and poor oral hygiene. Among primary care clinicians, screening for dental caries can be performed during routine exams. The study found that SECC is most common in children who have been breastfed for at least 24 months. This research indicates that breastfeeding is beneficial for a child's health. It was funded by the World Health Organization, the Wellcome Trust, and the National Support Program for Centers of Excellence, NSCO. In the U.S., primary care providers are more likely to have contact with children younger than 5 years. U.S. reviewed evidence from only a few studies that focused on the age range between 5 and 11 years, which is not representative of children in most communities. The results of these reviews are needed to inform the practice of oral health for children. Costs. The total cost of caries care for children in the U.S. varies from PPP $10.9 million to more than $27 million. According to the National Institutes of Health, the cost of dental caries is estimated at $298 billion a year. With the direct cost of tooth decay ranging from 5 to 10% of national health care budgets. While bite-wing radiographs are the standard for diagnosing interproximal dental caries, they are seldom used in Japan. A recent study examined the economic burden of dental caries in Japan. It found that dental caries are costly for patients when untreated. While the costs of treatment are high, dental diseases can also have long-term effects. Health economists should assess the health impact of dental diseases on a population so that they can allocate scarce resources effectively. For this, there is a need to develop more effective prevention and treatment methods. There needs to be more research and comparative analysis to determine the cost-effectiveness of different interventions. Thanks for watching. Please like, share, and subscribe.